Hey everybody, welcome back to another educational video from I Am Health Education. So today we're going to be talking about becoming a certified health education specialist, or aka a CHES. So we're going to talk about the journey and the benefits to becoming a certified health education specialist today. All right, for those who have not watched my video before, my name is Nakia Bolden. I am a certified health education specialist, so that is my signature right there. I graduated in May 2020 with my Bachelor's of Science in Health Sciences with a concentration in health promotion from the Indiana University. I have been working with the COVID-19 team since early 2020 in Indiana. I became a certified health education specialist in October 2020, just a few months after graduating with my bachelor's degree. In November 2020, I started a non-for-profit called I Am Health Education. We are dedicated to increasing health education resources, health literacy, and equity across the board. I just post health education videos and provide people with resources, science-driven, peer-reviewed, credible resources with the most accurate and up-to-date information. I am currently pursuing my Master's of Public Health from the Indiana State University, and I currently, as I said, I work with the COVID, so I currently work for the government in Indiana with the COVID-19 response team. So we're going to dive right in here. What is CHES? And what is a Certified Health Education Specialist? So a certified health education specialist, I'm just going to refer in this video as just a CHES. CHES must hold a bachelor's, master's, or doctorate degree in health education or significant and specific coursework in the field. So my bachelor's is in health promotion. So you have to have a specific number of credit hours in the health education or like health promotion field. And then you are eligible to take the CHES exam. So the health educators collect and analyze data to identify community needs prior to planning, implementing, monitoring, and evaluating programs designed to encourage healthy behaviors, lifestyle decisions, policies, and environments. The U.S. Department of Labor, the Bureau of Labor Statistics, has a classification of health educators and define health educators as those that provide and manage health education programs that help individuals, families, and their communities maximize and maintain healthy lifestyles. So health educators just promote health. They give you resources and education guidelines on how to maintain your health and maximize your health to decrease communicable diseases. So a MCHES, aka a Master of Certified Health Education Specialist, is an advanced level practitioner that has met the academic qualifications. They either hold a master's degree or they've worked in the field with their CHES for a minimum of 5 years. You cannot take the exam if you have not had your master's or you have not worked in the field for 5 years. And they must satisfy the continuing education requirements, which we're going to talk about later in the video for the CHES. So there's CHES and then there's MCHES. As I said, the MCHES is more advanced than the CHES. CHES is more entry level. And we're going to compare the two in the next few slides. Okay. So the CHES and MCHES examination, they're certified through the National Commission of Health Education and Credentialing, aka NCHEC. The CHES certification program has been NCCA accredited since 2028, and the MCHES has been accredited since 2013. MCHES is fairly recently newer than CHES. The National Commission of Health Education Credentialing has earned creditation as a personal certification body by the International Accreditation Services. So the NCHEC is accredited. It's an international accreditation agency that's been accredited by the International Accreditation Agency. The benefits of certification. So it established national standard for skills. You can take it anywhere in the world because it's nationally certified. And I'm a CHES, I'm a Certified Health Education Specialist, no matter what country you live in. It confirms your knowledge and skills. You took an exam, so you are certified in this specific profession. You passed the exam, you met the bare minimum criteria to practice this profession. It helps employers identify qualified candidates to see, especially if they're looking for a CHES, a health educator, they're going to look at two candidates. They're like, oh, she has CHES certification and she's met the standard, the minimum standard to practice her profession. So maybe she might be a better qualified candidate than this one that does not have it. It provides a sense of pride and accomplishment for sure. I have my accreditation on my wall as well as my 2 degrees right next to it. It promotes professional development for sure. When you take your exam and you do your continuing credentialing hours each year, you learn a lot of stuff. I love the continuing credits because I'm a lifelong learner. So I love learning new things. I love a challenge, and you get to pick different topics that you see, and you take that webinar, you take that course, and you get your credits, which helps for your maintenance of your certification. But you also learn new things, especially some specific subjects that you're really interested in. You get to dive deep into that, like health equity, health literacy, screen time, like exercise, obesity, diabetes. You learn so much taking these webinars and continuing credits. So we're just going to compare the 2 exams. So the CHES, like I said, is entry-level competence, and the sub-competence of the 7 responsibilities is 165 questions. You have 3 hours, and you're certified for 5 years. CHES is advanced and entry-level competence. Same 7 responsibilities. You still have 165 questions, multiple. You still have 3 hours, and you still are certified for 5 years. And this is just a breakdown of the CHES and the CHES exam. You have different percentage of the questions on the exam. Like, for instance, in CHES, you have responsibility number 1, assess needs, resources, capacity for health education, health promotion. That is worth 15% of the question. Well, that is 15% of the questions on the CHES exam. But that same category is only worth 10% of the questions on the CHES exam. 20% of the questions on the CHES exam, which is the biggest portion of the exam, is dedicated to conducting evaluation, research related to health education and health promotion. On the CHES part, their biggest part of the exam is planning health education, health promotion. So CHES is more a planning dedicated, no, I'm sorry, it's not planning, it's implement health education. So CHES is more dedicated to implementing, and CHES is more dedicated to evaluating and research. As you can see, research and evaluating is going to be more advanced than implementing a health education program. So there's 7 responsibilities of the CHES as of 2020. That is set to change. We're going to talk about that in a few slides. Area 1, you're going to access the needs and resources, and you're going to do a capacity, aka a windshield tour for your health education and promotion. So capacity is just you're gonna go in that community and see what they need. You're gonna look in that community and say, oh, this is what you need, and this is the resources that you have already. So how can we help you better? Area 2, you're gonna plan the health education program. Area 3, you're gonna implement it after you plan it. Area 4, you're going to conduct evaluation and research related to health education. You're going to always evaluate your program to make sure that the needs were met, your goals were met, your objectives were met, the vision was met, the mission was met. Did the participants like the program? Did they learn anything? If they learned something, What did they learn? That way, when you implement your program again the next year, or you can publish your data, you can say, hey, they learned this because they said this with the evaluation. You're not going to know if they learned anything if you do not evaluate. Research is always important. You're going to research the best plan, the best implementation, the best program for your population, and any obstacles that you may incur during the process of you implementing and planning and then conducting evaluation. You're going to see all of that stuff when you research. Area 5, you're going to administer and manage health education, health promotion. So that means making sure the program is run correctly, making sure that your staff that's running the program is trained correctly, any resources, any grant writing, you're going to take care of all of that in your administer and manage health education, health promotion portion of the CHES responsibilities. Area number 6, you're going to serve as a health education / health promotion resource person. I talked about this on my previous video. By serving as a resource person, you're going to provide people with resources, credible resources for them. By me really sharing these health education videos and these health education slides, I'm acting as a resource person. By me making a CHES study guide, I'm acting as a resource person for my profession. I'm giving them resources to better them in their profession and help them pass the CHES exam. Area 7 is the last area in the competence as of 2020, even though this video is recorded in 2021. Next year is going to change, and like I said, we're going to talk about that soon. So the last area is communicate, promote, and advocate for health education, and the profession. This PowerPoint, this video, it's me promoting and advocating for the profession. I'm giving back to the profession. I'm saying, hey, this is how you become certified. This is how you maintain certification. This is what a CHES this is what a CHES is. Just communicating health. So these are the new responsibilities that's coming effective on the 2022 exam. Area 1, assessment of needs and capacity, same as before a little bit. Area 2 is still planning, of course. Area 3 is going to be implementation. Area 4 is still evaluation and research. As you can see, Area 5 is now advocacy. It used to be the last one, but now it's Area 5 is advocacy. Area 6 is communication. Communication has its own area, which is awesome. Area number 7 is leadership and management. Same as area, the last area on the on responsibilities 2022, but it's kind of different because it was administer health, and now your leadership and management. And area 8 is ethics and professionalism. That was not in the last responsibilities of a CHES. They did talk about it in the book that I read and studied to become certified before passing the exam a little bit, but now this is a whole responsibility. So they're going to dive deeper into the ethics and the professionalism of a CHES. Right. So you're going to renew your credentials annually by paying a $60 fee. You must satisfy 75 continuing credits in a 5-year period. So you do want to complete those 75 credits within those 5 years. You do not want to wait to the last minute and cramp all those courses during the last year or two. These are 75 continuing education credits. A lot of times these webinars they're only providing 1 credit. So you're going to take 75 webinars in the last 2 years or 1 year. No, you want to break it down to 15 hours a year. So try to do 15 hours each year, just dedicated to going to webinars, completing those contact hours to get your credit so you can maintain your certification. 5 of those credits must be continuing competency contact hours. You can look on the NCHEC website to see what webinars have those continuing competency credits that you must complete. It's only 5, so you might take like maybe 2 webinars to get those 5 credit hours. Again, a lot of the webinars do have 1 credit hour, but there's a lot of them with more. There are webinars that cost money, but there's also a lot of free webinars. I have not had to pay for one webinar, and I just got certified in October, and I have 40 contact hours already. But again, I'm a lifelong learner. I love learning new things. You get to look at the website and see like what webinars or courses are out there that you find interesting. Take those courses, you learn something, especially if you really want to learn about that subject, and those are going towards your continuing education hours. So category 2, you need to have a minimum of 45 credits. Category 1 is going to be on the NCHEC website. You normally do not have to turn anything in. They automatically report to the accreditation agency to put those credits on your transcript. Category 2, you have to have a maximum of 30 credits, or you can have 75 credits in category 1. You do not need any category 2. But if you do category 2, you do need a maximum of 30, so you cannot go over 30 credits. I completed this grant writing course to just do something, and I wanted to learn about grant writing, and I turned that in, and I got a few credits for that, for my continuing education credits. So do keep that in mind when you do go to those webinars. You complete like an online course that's like free. You can turn it in to see if you will get those credits. Again, because I did, and I learned something, and it went towards my CHES certification renewal. So for instance, I got my exam. I passed my exam in October 2020. I have to September 30, 2025 to complete all of my credits. Again, I'm at 40, and it's only been a few months. So recertification tips. Okay, so complete or try to complete 15 hours each year. That way you don't cramp everything last minute, and you still have a lot of room to take a few courses every few months. You're going to search the website right there on the screen, the nchec.org, for free continuing education contact hours, aka CECH. You're going to follow them on Facebook, LinkedIn, Instagram to get up-to-date job posting and free webinars. I do not check their website all the time, but I do follow them on Facebook and LinkedIn and Instagram. And when I see that they have like, oh no, they're offering free CECHs by attending this webinar, or like, oh, it's free, 3 free or 5 free continuing education credits by completing this this diabetes webinar. And if I'm interested in it, I'm going to click on it and register. So you do not need to check that website all the time, but if you follow them, you're going to get that up-to-date information. When they post something, you're going to see it and you can register. You're going to keep a spreadsheet of your education credits and try to compare them to what is on your transcript and what you actually completed. Sometimes these organizations do take a few months to post your credits. You need to make sure that you have that proof. I make sure I got the proof, the confirmation, all that, to make sure, hey, you know, this has not been reported, what's going on. You also can explore the CDC website. They have a lot of free continuing education courses that you can check into. Really interested in different side of everything, more like communicable disease or like equity. But yeah, that's a resource I use for my continuing education credits. And this is my reference. I got everything from the National Commission for Health Education Credentialing. I didn't really look at my book, but a lot of the stuff I knew before because, again, I'm a CHES, and this is my job to know this. So thank you. I hope you learned something from this video, and you have a great day.